Thank you for watching this video. This is YouTube Medical University. This time the video is about Heberden's nodes. Heberden's nodes are a well-known condition where the first joint of the finger becomes swollen. In fact, it is said that about 90% of people over the age of 40 have this finger deformity. If you leave the condition explained in the video unattended, inflammation can occur, which leads to pain, further joint deformity, and even more inflammation, creating a vicious cycle. Heberden's nodes, which trouble many people over the age of 40. Even when you visit a hospital or osteopathic clinic, you're often told joint pain is just from overuse and nothing can be done. It's also common not to get a clear diagnosis or to not be taught the proper way to deal with it. And when it comes to Heberden's nodes, all kinds of information is circulating. Some even suggest draining the fluid from your joints by yourself, but please never do this. In the worst case, it could destroy your joints or even lead to finger amputation, so this is something you absolutely must not do. Now, what kinds of treatments are there to prevent Heberden's nodes from getting worse? There are self-care methods and commonly used supplements that I will also introduce. By watching this video until the end, you'll learn about treatments to prevent Heberden's nodes from getting worse and how to avoid making the condition even more severe. You'll learn about incorrect treatments and coping methods. To live vibrantly later in life, it's important to address finger pain. If your joints become deformed, you might not enjoy the things you once did. That's possible. Let's learn together in this video. I'm Dr. Sugu Shinryuka, a general practitioner in Hokkaido. Nowadays, all kinds of information are circulating. While much of it is useful, some of it is incorrect. I'll share information responsibly to help you avoid regrets from misinformation. Subscribe to my channel to stay updated on new videos. Here's today's agenda. In the first section, I will clearly explain what Heberden's nodes are. In the second section, I'll talk about some surprising symptoms of Heberden's nodes. And in the third section, I'll explain how to tell if your joint pain is really caused by Heberden's nodes or if it might be another condition and what points to look out for. In the fourth section, I'll introduce things you absolutely should not do if you have Heberden's nodes. And finally, in the fifth section, I'll share 6 ways to treat Heberden's nodes. And in this video, I'll be talking based on the guidelines from the 2018 European League Against Rheumatism. So first, what kind of disease is Heberden's nodes? Please take a look at this illustration. This is a drawing of the first and second finger joints. Seeing is believing, so please look at this image first. As you can see, when you develop Heberden's nodes, the first joint of your finger swells up, and as it progresses, the first joint becomes deformed and bent like this. As for what happens to the bone, these changes are caused by the cartilage in the joint wearing down. Please take a look at this illustration. Between the bones of the first joint, there is this blue part which is cartilage. However, when this cartilage wears down, the bones start to rub against each other and become more likely to shift out of place. To prevent the bones from shifting, bone spurs form, causing the bone to grow outward and become jagged like this. These are the kinds of changes that occur. Because the bone becomes jagged and larger, the bones rub against each other and cause inflammation. When this inflammation occurs, you feel pain in the first joint. In fact, Heberden's nodes are often dismissed as being caused by overuse. And while overuse is considered one possible factor, other factors such as hormonal changes and genetics are also thought to play a role. The truth is, the exact cause has not been clearly identified. As I said before, cases rise quickly after age 40, especially in women. It often happens during menopause, when female hormone levels drop. At this timing, it is said that Heberden's nodes are more likely to appear. Actually, there is a membrane called the synovium that covers the cartilage of this joint. It is said that this synovium has estrogen receptors, which are receptors for the female hormone estrogen. When women reach menopause and their hormone balance changes, estrogen levels decrease, causing the synovium to react and swell. There is a hypothesis that this leads to the progression of Heberden's nodes. There are treatments that supplement the decreased female hormones, and I will explain those in detail in the 5th session. And as for Heberden's nodes, actually, there are many people who say, my joints are swollen too, but I don't really feel any pain. In fact, about 90% of people over the age of 40 have some kind of finger deformity, but it's said that only 5.7% of men and 8.2% of women actually experience pain due to these deformities. In other words, just because your joints are swollen doesn't necessarily mean you'll have pain. There are many cases of Heberden's nodes that don't cause pain. So next, I'll explain what other symptoms and impairments Heberden's nodes can cause besides pain. Actually, with Heberden's nodes, as the condition progresses, the fingers become deformed and grip strength is said to decrease. In a study that followed people with Heberden's nodes for 10 years, there was data showing that grip strength dropped by 3 kilograms. Also, once you develop Heberden's nodes, you can't move your first joint properly, so when you try to grip something tightly, it becomes harder to apply force, which leads to this kind of impairment. And it was also found that the symptoms of finger deformity vary from person to person. This finger deformity was studied in a group of 289 people with Heberden's nodes in the Netherlands. In a study that followed patients for 6 years, it was found that those with more severe joint pain, swollen or puffy fingers, and higher levels of inflammation were more likely to experience progression of finger deformity. In other words, if you have pain, swelling, or inflammation, you are more prone to deformity. So if you find yourself fitting these descriptions after watching this video, I hope you'll pay close attention to the treatment methods I'll explain later. Also, just because you don't have pain doesn't mean you won't develop deformity, so I'd be happy if you watch the video to the end to learn how to prevent further progression. And for those of you who are currently suffering from pain, the pain caused by Heberden's nodes isn't due to the deformity itself. The pain comes from inflammation, so if you can control the inflammation, even if the deformity can't be reversed, you can still relieve the pain, so please listen with hope. However, once joint deformity occurs, modern medicine cannot cure it, so honestly, I want to address it before it progresses as much as possible. So in the third section, let's study a bit about whether the swelling in your finger is really due to Heberden's nodes. A well-known disease that causes finger swelling is rheumatoid arthritis. The difference between Heberden's nodes and rheumatoid arthritis is Heberden's nodes tend to cause swelling in the first joint of the finger, but with rheumatoid arthritis, it's often the second joint, the base of the fingers, the wrist, and even the elbows or shoulders that hurt. So, if you only have pain in the first joint, the likelihood of rheumatoid arthritis is quite low. On the other hand, if you have pain not only in the first joint, but also in the second joint or other joints, there's a possibility that it's not just Heberden's nodes, so it's important to get a proper diagnosis. To determine whether it's likely to be rheumatoid arthritis, we take X-rays and check for specific antibodies through blood tests. This is often done. The reason is, rheumatoid arthritis is an autoimmune disease, which means that the immune system, which normally fights off germs, mistakenly attacks your own joints. Because of this, measuring antibodies in the blood helps us get closer to a diagnosis. Before you decide not to go to the hospital, thinking it's just Heberden's nodes from overuse and there's nothing that can be done, it's important to first question whether it really is that. That's because, in the case of rheumatoid arthritis, various medications have been developed, and many people improve by using drugs that suppress the immune system. Besides that, there are other autoimmune diseases and infectious arthritis, which can also cause swelling in the first joint like Heberden's nodes. If you look closely, sometimes the skin is rough, or in the case of autoimmune diseases, there may be rashes or redness on other parts of the skin, or redness around the nails. There are various clues. If you want to learn more about autoimmune diseases, please watch this video. I'll put the link in the description. By the way, changes in the nails can indicate disease, so if you're concerned, check out this video. The link is in the description. Now let's review what we've covered. Heberden's nodes they start to increase rapidly after your 40s. And while the exact cause isn't clear, changes in hormone balance, genetics, and overuse are thought to be factors. Many people have no symptoms, but about 10% of them experience pain. If this pain is left untreated, the joints are more likely to become deformed, inflammation can progress, and the pain can get worse, creating a vicious cycle. That's why it's important to address it early, and as a basic premise, is it Heberden's nodes? Or could another condition be involved? I noted the importance of testing to find out, especially if you have these symptoms. If you have questions like, what about in this case? please join us for our regular live streams every Tuesday at 9 p.m. on YouTube Medical University, where you can ask your questions and I'll be happy to answer them. If you found this helpful, please subscribe to the channel so you don't miss any new videos. I'd really appreciate it. Now, in the fourth session, I'll introduce things you should absolutely avoid doing if you have Heberden's nodes. That is breaking the fluid-filled sacs that appear due to Heberden's nodes. Are you wondering, fluid-filled sacs with Heberden's nodes? If so, please take a look at this photo. You can see a swollen bump at the first joint. This is called a mucus cyst. It's also known as a mucus cyst. I think many of you have heard of a ganglion cyst, right? Please understand that a ganglion cyst is formed when joint fluid swells up and creates a lump. The ganglion cyst that forms on a Heberden's node is what we call a mucus cyst. Now let me explain how this happens. Please take a look at this illustration. This is a side view of a finger. Here is the fingernail, and then there is a joint here, and as I mentioned earlier, the joint has cartilage, and inside it there is a fluid called synovial fluid. When this joint fluid leaks out and swells up under the skin, it forms a mucus cyst. In other words, the pool of fluid that collects here is actually joint fluid. Therefore, you can treat a ganglion cyst yourself with an injection. That kind of thinking is a big mistake. If you make a hole here, the joint fluid will just come out. What's wrong with that? The problem is infection. Actually, inside the joint, there are no blood vessels. So once it gets infected with bacteria, it's hard for immune cells to reach it. Even if you use antibiotics, it's difficult for them to reach the joint through the bloodstream. In other words, infections in the joint are very hard to cure. So what I absolutely don't want you to do is, when a bump appears from Heberden's nodes, thinking it's just a blister and popping it yourself, please, really don't do this. The swelling is right under the skin and looks transparent, so it might seem easy to pop. It may look ready to burst, but don't break it. Worst case, it could get infected. You might not be able to move your joints properly, or you could even be forced to have an amputation or need surgery. Some people might think, then I just need to disinfect it well so germs don't get in. But our skin has resident bacteria, like Staphylococcus epidermidis. Germs are always present on our skin, so it's very difficult to make it completely clean. In any case, please don't break it on your own judgment. And there are some other things I don't want you to do either. One of those is trying to cure Heberden's nodes by massaging them. Some people say that since Heberden's nodes are lumps caused by overuse, you can solve the problem by massaging them properly. However, there is no solid data to support this. It might work for some people, but there is no data showing that it will cure everyone, so please be careful. On the contrary, if you carelessly massage the area while it's inflamed, the inflammation can get worse, the pain can increase, and the deformity can progress even further. I think that's even a possibility. It's not that your fingers are just stiff and tight, it's a deformity of the joint. If you keep that in mind, you'll be less likely to fall for this kind of misinformation. And if you remember the reason behind it, it's harder to forget. That's why at YouTube Therapy University, we make sure to clearly explain the reasons as well. Now it's finally fifth period, about Heberden's nodes. What kinds of treatments are available? This time I'll demonstrate self-care methods and also talk about supplements. I'll introduce them in order of priority, so please listen until the end. 6 ways to treat Heberden's nodes. The first is anti-inflammatory analgesics. You might think, aren't anti-inflammatory analgesics just painkillers? I went to the hospital hoping to cure my Heberden's nodes, but the doctor only gave me painkillers. Actually, for Heberden's nodes, these anti-inflammatory analgesics are introduced as a high priority treatment. Anti-inflammatory analgesics are generally available over the counter. Examples include Loxonin and Voltaren. In fact, as the name suggests, these medications reduce inflammation, and there is solid data showing that they help relieve pain. However, these anti-inflammatory analgesics, they can cause side effects such as stomach problems or kidney issues. Because of these side effects, it's not recommended to take them casually just because you feel a little pain. You should weigh the benefits and drawbacks. If the pain is unbearable, even when you're not moving your joints, or even when you're just resting, then you should consider taking them. Many people with Heberden's nodes experience pain when they move their fingers, so keep your fingers as still as possible and rest them. If you must move them and pain begins, take painkillers beforehand. That approach That kind of approach is also possible. By the way, instead of taking painkillers orally, you can actually use pain relief patches or apply pain relief ointments as well. This works for Heberden's nodes because the skin to joint distance in the finger's first joint is short. Ointments and similar treatments can reach it easily. For severe pain, using anti-inflammatory ointments or patches is an option. 6 treatments for Heberden's nodes. The second one is this: moving your fingers. Some of you might be thinking, didn't you say that moving them makes the pain worse? That's a sharp observation. It's true that moving them can cause more pain. If the pain is severe, exercise is not recommended. However, it's been confirmed that moving your fingers as much as possible without causing pain is effective. In fact, this approach is actually recommended. The exercises involve bending your fingertips like this, and also bending from the base of your fingers. By combining and repeating these kinds of exercises, you can help manage the condition. As I mentioned earlier, Heberden's nodes can lead to decreased grip strength. So, squeezing a soft ball, like the ones you can buy at a dollar store, without causing pain, is another recommended exercise. If the pain is in the first joint, try gripping the ball using the base joints instead, so you don't use the painful joint. These types of exercises are actually recommended as treatments for Heberden's nodes. In addition to bending your fingers, there are also exercises where you stretch them out, so please try to find the ones that suit you best. Be sure to try these exercises while consulting with your primary doctor. Data shows exercising your hands after warming them in hot water is effective. So try moving or stretching your hands during or right after a bath. As I've often said, only do these exercises within a pain-free range. Putting stress on sore joints can increase inflammation and worsen pain, so be careful. Also, exercise isn't only for your hands. It benefits your body and can help with high blood pressure and diabetes. And lowering cholesterol. There is solid data showing that it helps prevent heart attacks and strokes. 6 treatments for Heberden's nodes. The third one is this: resting. Some of you might think, if I could rest, I wouldn't have any trouble. And I agree. There's probably no one who hasn't used their hands at all today. In other words, it's difficult to avoid moving your hands, but I recommend using tape or a splint to limit the movement of the first joint. For taping, you can wrap tape around the first joint of your finger like this, which makes it harder to bend and helps keep the joint at rest. One thing to be careful about is that if you wrap it too tightly, it can reduce blood flow to your finger, which can actually cause pain or make your finger turn bright red. If you wrap it too tightly, that's not good, so it's important to wrap it with just the right amount of tightness. However, if wrapping tape all the way around your finger makes it hard to bend or makes fine tasks difficult, you can just put tape on the back of your finger like this, and then place 2 strips of tape horizontally across the joint. Even this can help limit the movement of the first joint. The advantage of tape is that it's easy to do yourself, but the downside is that it comes off easily. If it gets wet, its effectiveness drops quickly, and so on. Nowadays, there are various types of splints available. Sometimes metal splint rings made of tin are used, and there are also small splints that can be fastened with something like Velcro. If you're struggling with pain or want to improve your condition even a little, please give these a try. Taping is probably the easiest method to do by yourself, so I recommend starting with taping. If you find that it works well for you, you can try other methods of immobilization as well. As for recommended tape, there are medical tapes available that are also used in hospitals. They have just the right softness, are in colors that don't stand out when wrapped on the skin, and are breathable and resistant to moisture. I'll put a link to the recommended tape in the description. 6 ways to treat Heberden's nodes. The 4th is surgical treatment. Surgery is considered when the pain from Heberden's nodes becomes unbearable. For hip or knee surgery, for example, there are artificial joints that can be implanted, allowing you to bend and stretch as if they were your own joints. However, Heberden's nodes occur in the first joint, which is very small. Currently, there are no surgeries to insert artificial joints into this joint. So, what kind of surgery is performed? If you look at a finger from the side, Heberden's nodes are caused by the cartilage wearing down, and in its place, bone grows out like a spur, causing inflammation and pain. In surgery, what they do is shave down the protruding bone, and then actually fuse the bone above and below the joint together. By doing this, the bones no longer shift against each other, which eliminates the pain. So, do you understand what this means? Since the bones are fused together, the first joint can no longer bend or straighten like this. In exchange, the pain goes away. In other words, you have to choose between having a finger that doesn't move but is pain-free, or enduring the pain but keeping the ability to move your finger without surgery. This surgery is about weighing these options and deciding which is better for you. Whether or not you should have surgery is a very individual decision, so if you're unsure, I think it's best to consult with a doctor who specializes in hands within orthopedic surgery. And of course, having surgery also comes with the risk of complications. There are risks involved, as I mentioned earlier. Since fingers have little cushioning, wounds can be slow to heal, and because blood flow is limited, there's also a higher risk of infection after surgery. Taking these risks of complications into account is part of the actual decision-making process when considering surgery. 6 ways to treat Heberden's nodes. The 5th one is this: taking supplements. Although the level of recommendation for this isn't very high, I'm introducing it because it's widely used. As I mentioned at the beginning, Heberden's nodes are more common in women, and one of the main causes is actually thought to be the decrease in estrogen, a female hormone, during menopause. That's why supplements that help replenish this hormone are sometimes used for Heberden's nodes. In fact, even in the book Today's Treatment Guidelines, this method is introduced as a treatment for Heberden's nodes. Commonly used, the supplement contains Aquil. This is a substance that has a structure similar to estrogen. So what kind of substance is Equal? Actually, when we consume soybeans, Equal is produced in our bodies from the isoflavones contained in soybeans. Because Equal has a chemical structure similar to estrogen, it is believed to act like a female hormone. However, it is said that only about 50% of people can actually produce Equal in their bodies. For this reason, by taking Equal as a supplement, there are attempts to see if it can improve joint pain. By the way, there is no solid data showing that Equal improves arthritis in Heberden's nodes. However, Equal has been shown to help with hot flashes, irritability, and insomnia associated with menopause. There are research results showing that it is effective for heart palpitations and shortness of breath. Since joint pain can also appear as a symptom of menopause, Equal is used with the expectation that it will be effective for these kinds of symptoms. Equal itself is produced in the body from soybeans, so it does not have strong side effects. I recommend consulting your primary doctor. If the pain is severe, Equal may be an option. But as with anything, side effects are possible. If you notice little effect, stop using it early. And whether or not your body is producing Equal can be checked with a test. You can also get tested, so if you want to know more, I'll put a link in the description. Heberden's nodes. 6 ways to treat it. Here's the 6th one. I'll introduce them all at once, using other painkillers, getting steroid joint injections, heat therapy, acupuncture treatment, wearing a brace, and taking vitamins. These can be mentioned. These are weak recommendations, meaning there isn't solid data, but they don't have significant harm, so it's positioned as something you might want to try. Other painkillers like acetaminophen generally include commonly used painkillers. Also, steroid injections have an immunosuppressive effect, so they help reduce inflammation. By reducing inflammation, they help relieve pain, which is why they are effective for Heberden's nodes. And vitamins are a bit surprising, aren't they? There is data showing that 98% of Japanese people have low vitamin levels. For those with osteoporosis, I actually prescribe them at the hospital as well. It's a very important nutrient that may help strengthen bones and reduce the risk of falls. You can produce vitamin D in your body by getting sunlight. However, that's often not enough, so consciously eating mushrooms and fish to supplement vitamins might be effective for Heberden's nodes. Let's review what we've covered so far. As for the 4 things I absolutely don't want you to do. When it comes to mucus cysts, where joint fluid from Heberden's nodes swells up under the skin, making a blister-like bump, you should absolutely never stick a needle into it to pop it. It can cause infection and in severe cases may require finger amputation. Otherwise, Heberden's nodes since they are lumps, massaging them will not make them go away, and generally recommended. Treatments usually include anti-inflammatory painkillers, exercise, and taping or bracing to immobilize the area, if it won't heal surgery. and also taking a supplement called Equal, which is similar to estrogen. And as the 6th point, I introduced these as a week recommendation. If you want to know how to efficiently get vitamins, I recommend this video here. I'll put the link in the description. So what did you think? This video was a bit long, but by watching it, Heberden's nodes, why do they occur and how can you treat them? I think you were able to learn everything, including what you shouldn't do. At YouTube Medical University, we share easy to understand, responsible medical info from a doctor's perspective, including explanations. If you like this video, please give it a thumbs up. It really motivates me. Please subscribe so you don't miss new videos. If you found something helpful or received good advice from your doctor, share it in the comments. Let's learn together. See you in the next video. The Way to Live Agelessly from Your 70s, which I learned from my patients as a general practitioner, became a bestseller in 4 Amazon categories and ranked #1 for gifts. These lessons came from my experience as a doctor. I've gathered key health and lifestyle tips into one book that will inspire you to want a healthy life too. It's on sale and getting great reviews, so check it out. Thank you for watching.